Today we'll be seeing about dynamic stabilization of the glenohumeral complex, just about the deltoid muscle. Now when you are talking about dynamic stabilization, this means that whenever your arm is moving, at that point your humeral head does not move out inferiorly or even does not come out anteriorly or posteriorly. For those times all the muscles have to work, and the number one muscle which will work is the deltoid muscle. Today we'll be talking about the deltoid muscle. I'll put a picture up here for understanding purposes. How are the vectors made? So the most prominent problem of the glenohumeral complex is the humerus has a tendency to glide inferiorly because under the effect of gravity. When the arm was not working, the problem was solved by the static stabilizers, okay? But now when the arm is working, the static stabilizers cannot work individually for the humerus to not come out. So now comes the action of muscles. So if you imagine that this is my humerus and an inferiorly directed force is acting by the gravity. So just by a common sense, you will require some upward direction force to keep it in the same position, which is given by the deltoid muscle. We all know that deltoid is an abductor of the arm, but the anterior fibers of deltoid, they are also a flexor of the arm. They contribute, a little bit contribution comes from the anterior fibers of deltoid also. So when you make a resultant vector, what you will see is there is an fx component and there is an fy component. And when you combine those things, there is a resultant vector, which is the fd, which is formed. Now that fd is in the upward direction, and that is big enough. So it is big enough for the gravity to act upon it. So your head is going to remain superiorly when the movement is happening of flexion. So that problem is solved. The inferior translation during the movement will no longer be happening because there is a vector, the FD, which is going to prevent the inferior translation of the humerus. But what about rotation? For that, you need to see the next part. Happy learning.